The mission of our program is really to build a program for the residents. Our job is to provide the environment in which they can succeed according to what their goals are.
Finding a place that has a lot of support for whatever career path you end up choosing is really important. We have a significant breadth and depth, I think, of the clinical experience here at Beaumont.
We are well versed in all of the disease sites. We have a really busy brachytherapy program, so they get brachytherapy technical skills as well. We have a gamma knife center, so they learn about stereotactic radiation. We have a proton center, so they get the added benefit of learning about proton treatment, and they see an increased number of pediatric cases as a result.
And in terms of the volume of patients that you see, we are a tertiary referral center, so we see the bread and butter stuff, but we also see some of these really complex cases and also rare cases that get referred to us.
Obviously, being involved in research and being able to offer patients new or novel therapies that they may not have access to everywhere is a wonderful feeling to be able to do.
Research is part of the fabric of this program, as it's a way to make treatments better. One of the unique aspects of the program here is just a diverse portfolio of research. It's really based on the interest and drive of the individual resident, and all of those opportunities are available to them.
There are people who are super into research and they know it early, and there are people who maybe aren't super interested in research and they're here to take care of patients, and this is the thing that motivates them. And then there's a whole spectrum in between those 2 points. We have support for that whole spectrum.
Residents are coming here to learn. We want them to feel comfortable. We want them to feel like they're getting the best education possible, not just in terms of their didactics, but also in terms of what they're learning clinically. I just want everyone to feel like they're basically in their second home.
I want them to be excited about radiation oncology. I want them to be excited about the cool things they can do and have ideas about the kinds of things that they want to do when they come to Beaumont.
We have a lot of different people from different places and different walks of life.
We need to have people of different ethnicities, different religions, so that we can care for all of our patients in this very, very diverse country that we live in.
Our residents are really involved in patient care from the get-go.
When you're treating people for cancer, whether it's something that is truly a life-threatening malignancy or something that has a 90 to 95% cure rate, at the end of the day, it's still cancer, and that affects people very profoundly.
I think it's just really nice to be able to foster that relationship with people and help them in probably one of the most difficult times in their lives. And I just wouldn't change it. I love what I do.
One of the key features that I wanted to build for this program is that we would have a very accessible faculty and wonderful trainees that are delightful to be around as people as well as doctors.
Being able to be involved in the teaching of residents and the teaching of medical students and contributing to future contributors to the field is what makes it very exciting to be a part of a place like this.
I can only speak from my perspective as a medical physicist, but I think that we provide an excellent educational environment. I'm one of the co-authors of the textbook, The Physics and Technology of Radiation Therapy, along with Colin Orton. So I know what residents need to know, and they don't get out of my course until they know it.
The region is full of really nice people, tremendous restaurants.
The food scene out here is fantastic. The nightlife is great. If you're more of an outdoorsy kind of person, there's so much to do. The real question that you should be asking is, are the people who are graduating from this program getting the jobs they want? This was the job that I wanted.
We are innovators here at Beaumont. We develop cool new things, and we want new radiation oncologists to partner with us to develop cool new things with us.